Hello, I will be talking about the PTSD and suicide among veterans, a mental health disparity. Veterans are individuals that serve the military from different branches like the Army, Navy, Marine, Air Force, Coast Guard, and Space Force. According to the United States Census Bureau, in 2023, there are approximately 15.8 million military veterans living in the United States, with 1.7 million, or about 11%, that are female. Additionally, 27.9% of veterans are age 75 or older, which reflects an aging veteran population. Despite their diverse backgrounds, veterans often face shared mental health challenges due to the nature of their service. They have job-related trauma, combat exposure, and stress that contributes to elevated mental health risk. In a practical review of suicide among veterans, preventive and proactive measures for healthcare institutions and providers by Frank Ruiz and other researchers, veterans account for an estimated 14% of all adult suicides in the United States. Even though they represent a much smaller portion of the overall population, there is still a risk. And it's particularly high among female veterans who experience suicide at 2.1 times the rate of civilian women. Alarmingly, only 47% of veterans are enrolled in the VA healthcare system, meaning that there is more than half that lack access to veteran-specific mental health care services. And these statistics highlights the importance of addressing mental health as a population-level concern for veterans. The epidemiological data from American and British veterans strongly supports that suicide is a persistent health disparity. Research from Frank Ruiz shows that the suicide rate is 1.5 times higher among all veterans and 2.1 times higher among female veterans compared to the general U.S. population. According to the Prevalence and Risk Factors of Suicide and Suicidal Ideation in Veterans who served in the British Armed Forces, a systematic review by Rebecca Randles, in 2020 alone, over 6,000 veterans died by suicide, and 71% of those deaths involved firearms. That same year, the overall veteran suicide rate was 57.3% higher than the rate for non-veterans. Randles and colleagues also reference a quantitative study by Rodway and other researchers, which found that young veterans aged 16 to 24 had suicide risk 2 to 3 times higher than people in the same age group in the general population. The 2024 National Veteran Suicide Prevention Annual Report created a visual graph of the suicide data from 2001 to 2022. The average number of suicides per day in 2022 is 131.2 per day among U.S. adults. That includes 17.6 per day among veterans and 113.7 per day among non-veteran adults. Among all U.S. adults, including veterans, the average number of suicides per day rose from 81 in 2001 to 131.2 in 2022. The average number per day among U.S. adults was highest in 2022. Lastly, the average number of veteran suicides per day rose from 16.5 in 2001 to 17.6 in 2022. This long-term tracking clearly illustrates the ongoing nature of this mental health disparity and the need for continuous intervention. There are barriers that contribute to the mental health disparity faced by veterans. One of the most significant barriers is eligibility and access. Like mentioned from an article by Frank Ruiz, while the VA is the primary provider of veteran-specific care, only 47% of veterans are actually enrolled in the VA healthcare system. This leaves more than half without consistent access to specialized healthcare services. Another major issue is stigma, particularly surrounding mental health and gender identity. Many veterans avoid care due to fear of judgment or being perceived as weak. In mental health outcomes among transgender veterans and active duty service members in the United States, a systematic review by Carrie O'Leary For transgender veterans, even when they are comfortable disclosing their gender identity, they may still encounter insensitivity or a lack of provider knowledge, which becomes a significant barrier to receiving effective care. The last barrier is understaffing. This is a widespread problem, especially in rural areas. Veterans often experience long wait times for psychiatric or behavioral health services, which delays intervention and increases the risk for negative outcomes. To address some of these barriers, the VA Mission Act that was launched in 2019 by the Department of Veterans Affairs allows eligible veterans to receive care from community-based or private sector providers when VA services are unavailable or it's too late. While this is a positive step forward, challenges with provider availability and coordination still remains. Nurses play a vital role in identifying and addressing mental health disparities among veterans. One of the most important responsibilities is to be aware of suicide warning signs. Like in the picture, these warning signs are suicide related communication, like suicide notes or mention of wishing to die, preparation for suicide, seeking access or recent use of lethal weapon, substance use, hopelessness, and other warning signs. Early recognition is key to prevention. Nurses should also implement evidence based screening tools during routine assessments. This includes the Columbia Suicide Severity Rating Scale and the PCL-5 or the PTSD checklist for DSM-5. These are used to assess the patient's suicide risk and PTSD. In addition to screening, nurses must provide culturally competent care. This includes taking the time to understand each veteran's unique background, religious beliefs, cultural traditions, and gender identity. By doing so, it builds rapport and trust and creates a safe environment for veterans to share their mental health concerns without fear of stigma or misunderstanding. By combining clinical tools with compassion, individualized care, and being an advocate, nurses can significantly reduce the risk of untreated PTSD and suicide among veterans. To effectively address the mental health disparity in veterans, we need to consistently evaluate and measure it over time. One way to do this is by tracking national suicide rates annually through the U.S. Department of Veterans Affairs. This data helps identify trends by age, gender, and service era. At the clinical level, we use screening tools like the Columbia Suicide Severity Rating Scale or CSSRS to assess suicide risk. The CSSRS includes a series of simple questions about thoughts of self-harm, planning, and past behavior. And then based on these answers, risk is rated as low, moderate, or high, which help nurses and providers decide next steps for the care. For PTSD, we use the PCL-5, which is a checklist with 20 questions based on PTSD symptoms. Veterans rate how much each symptom bothers them on a scale from 0 to 4. A higher score means more severe symptoms. And this is not just for diagnosis. We also use this to see if the treatment is helping them over time. Lastly, it is important to hear directly from veterans. We can survey them about their care that they're experiencing, if there is stigma, and their satisfaction, so that we can better understand the gaps in healthcare that we provide for them, if there's gaps in trust, comfort, and access. These combined tools allow us to track progress, we can improve care, and reduce the disparity. In conclusion, veterans face a significantly higher risk for mental health challenges, particularly PTSD and suicide. This is not just an individual issue, but the epidemiological data clearly shows that it is a measurable and widespread population health disparity. Veterans often encounter barriers to care. This includes eligibility, restrictions, stigma, and understaffing, which all of these limits the access to timely mental health services. Nurses play a vital role in addressing this disparity. Through early screenings, trauma informed care, and advocacy, nurses can help connect veterans to the support that they need and reduce the risk of untreated PTSD and reduce suicide risk. Finally, evaluating this disparity over time is important. The U.S. Department of Veterans Affairs provides annual suicide data. This helps us track whether the interventions done are making a difference. By combining clinical tools, compassionate care, and population level monitoring, we can work toward to close this gap in veteran mental health.